Hello everyone, welcome to Pharma Icon, and the today's topic is we will need to discuss about the trending topic HMPV, that is human meta pneumonia virus. Okay, what is HMPV virus? Okay, so what is a HMPV virus? HMPV is a mostly is causes to the upper and lower respiratory tract infection. Okay, mainly the respiratory tract will be infected due to this HMPV virus. Okay, and there is no vaccine for HMPV in current days. Okay, actually there is no vaccination for this virus, and it is the HMPV virus is consisting of a negative single strand of RNA. Okay, the type of DNA present in the HMPV vaccine is a single stranded RNA. Okay, coming to the history of HMPV, is HMPV is nowadays we using the different types of vaccines are affect the life of human beings, and last time we will affect the circumstances of COVID-19. Okay, same like that HMPV, it is also affects the lung disease. Okay, and when the HMPV virus is identified, it is identified in the first 2001. Okay, it is a common virus and which is specialized, mostly spread around the winter and spring season. Okay, so this is about the history of HMPV. And next, how many times a person suffer from HMPV? Okay, if a person is affected one time with HMPV and the next time other the person may be affected or not. Okay, so the answer for this is the HMPV is a reinfection virus, means it will be continuously affecting the person, okay, throughout the life. And the third one is foods to avoid during the pneumonia. Which foods we don't take during the pneumonia? The foods which are containing the high levels of sodium. Okay, they can be avoided because the sodium is a type of salts. The foods which are containing high amounts of salts, they may be leads to the shortness of breath. Okay, this is about the foods to be taken during the pneumonia. And next, what and first of all, the HIV is a human metapneumonia virus. And what are the symptoms of HMPV? The symptoms of HMPV is like a cold, runny nose, cough, rashes, fever, sore throat, and wheezing. These are the symptoms of HMPV. Okay, and persons to affect, those are the primary persons to affect these HMPV are the childrens above the age of 5 years, and other persons affected with HMPV are older people above 65 years. Okay, it is also affect with the people who are suffering with low immune system responses. Okay, so those persons may be affected due to the HMPV. Next, is HMPV is only a cold. Okay, in HMPV is a type of virus which is mostly associated with the respiratory tract. Respiratory tract is nothing but it is deals with the cold and other symptoms. Okay, so HMPV is not a cold. Okay, but people suffer with a serious illness, means the people are very sick due to this HMPV. Okay, next, ratio of illness, how much amount of people are got affected due to HMPV? 10 to 12% respiratory illness in the children, and 5 to 16% get respiratory tract infections in the children. Okay, 10 to 12% affected in children, and 5 to 16% respiratory tract infections may be occurred. Okay, next, what are the causes of HMPV and how this virus can be affected? First, virus can be replicate more copies of itself, and then it is a part of same group of virus may also cause the RSV, means respiratory sinusitis virus. Okay, it is also leads to measles and mumps. This is about the symptoms of HMPV. Next, what are the complications of HMPV? Okay, what are the complication comes under the HMPV if we may not treat the HMPV, like bronchitis, pneumonia, asthma or COPD along with the ear infection. These are the complication under HMPV. If HMPV is may not be treated, these complication can be occurred. Okay, next, how HMPV can be transmitted. It is a type of virus disease. Okay, how it can be transmitted? It can be spreads through the direct contact by touching of the contaminated objects. Okay, what are the objects that are touched by the virus that should may not be contact with the hands? Okay, or it may be spreads through by coughing, sneezing, when shaking hands. Okay, these are the vaccine areas to be contaminated. And next, what are the diagnostic tests involved in the HMPV? Okay, and the diagnostic test can be diagnosed by the healthcare experts based on the symptoms and history of the health of the person. Okay, and in that procedure of the diagnostics, first one maybe the swab is to taken to get the sample from the nose, and after the taking they are running in the laboratory examination to find out the how much amount the person to be affected, and next under examination is done. Sometimes the bronchoscopy and chest x-ray also be done for the diagnosis of this HMPV virus. Okay, and next one, treatment. The treatment for HMPV virus is there is no antiviral medication present days. Okay, and the treatment might be there is no viral medication for this, but we need to consult a doctor to prevent getting more sick. Okay, if there is no vaccine for this virus, means the person will be getting more sick day by day. Okay, it can be treated by oxygen therapy, IV fluids and corticosteroids may be used for treatment of HMPV. And next, there is no use of antibiotics for treating of HMPV. Why we do not use antibiotics here means antibiotics are nothing but the type of drugs mostly used to treatment for and prevention of the bacterial infections or killing of the bacteria. But here in HMPV, it is a virus. It cannot be cured by the use of antibiotics. Okay, viral diseases cannot be cured by using antibiotics. But at certain situations like pneumonia caused by the HMPV, the person may also get some bacterial infection. So that infection is called as a secondary infection. In that time, we can prescribe or using of antibiotics for the treatment of secondary infection. Okay, so that is about the HMPV virus. And next, what are the risk factors of HMPV? The risk factors associated with the HMPV are the age above 5 years and above 65 years are the people are associated with the more conditions for this HMPV, and the persons who are having autoimmune diseases and other diseases like AIDS, cancer and HIV, those persons are more risk for this HMPV. Okay, so these are the risk factors for HMPV. And next, how we should prevent the HMPV? First, reduce the risk of HMPV or other diseases causing due to the infectious agents. They are mostly prevented by covering your nose or mouth when you sneeze or cough and washing your hands. Okay, By washing our hands we can prevent those infection. And next, wear a mask and avoid unnecessary touching in the areas around the face, eyes, nose and mouth. And don't share food items and avoid being around with the people who are suffered with the cold, cough, even runny nose, etc. Okay. And next, the next topic is HMPV is serious? It is a mild disease and many complications are there due to HMPV, and it is also leads to the pneumonia. Okay, this is about the HMPV. And next, is there HMPV is need isolation? Okay, HMPV is a type of virus. The patients with HMPV infection, they are hospitalized. There will be a droplet isolation until clinical recovery. Okay, droplet isolation will be there in HMPV, and the duration of HMPV is last up to 2 to 5 days like normal cold. So there is no fear of HMPV, and we need to take some preventive measures for being of HMPV virus. Okay, so that's all for this session. Thank you, and do subscribe Pharma Icon.